I don't have statistics, but we would know that it's a very broad spectrum of women. It's young women, it's older women, it's women who are married, who already have 2 children, they don't have the funds to support another child. There's a variety of reasons that women will travel to access an abortion, and all of them are valid. In terms of talking about late-term abortions, I think the Master of the Maternity Hospital answered that question in previous hearings, but I think the principle that was accepted by the Supreme Court is that while there's equal rights between that of the mother and the fetus, if those rights are in conflict, then the rights of the mother prevails. So in theory, that situation could arise at any stage of the pregnancy, but I think we're talking about very extreme circumstances, and the longer a pregnancy goes on, the less likely that circumstance would arise. Given that in the UK, 87% of abortions occur in the first trimester. Now to go on to someone mentioning that doctors said there was no limits on intervention. Well, I think the Master of the Rotunda and the Master of the National Maternity Hospital would refute that in what they said during the hearing. And I think everybody, all of us here, had stated in our submission how there was a significant chill factor because of the 1861 Act, because abortion is criminalised, and it can criminalise a doctor acting in good faith and the woman. To go on to someone discussing fatal fetal abnormalities. What we're advocating for is for choice, for if a woman who is carrying a fetus with a fatal fetal abnormality, if they wish to access an abortion, that's their choice. Obviously, they should not be forced to do so. It's up to the woman's choice. And I think people, again, we've discussed this at length around how this implementing the X case would be opening the floodgates. I think it's very clear within our constitution that there's equal rights between the mother and the fetus. So if we wanted to have less restrictive access to abortion, we would need to have another referendum. I think that's very clear.
Thank you. Ms. O'Connor.
Thank you. I suppose I'll just try to address the ones that I didn't answer earlier, because I think some of them were. Just, I suppose, regard to, again, our organisation come to this very clearly representing the views of our members and their views that have been put forward through various motions at AGM. So there's a very clear and strong mandate there. And then the second issue that was raised was, where do the rights of the unborn fit in terms of this? And I think what's really important is that what we're talking about here in terms of the X case is where a woman's life is at risk. And we're saying that absolutely has to take precedence. In relation to the discussion on fatal fetal abnormalities, I think this is really important. From our perspective, we saw that it would be quite difficult, that if you were legislating for X, how that could be incorporated. We think it's really critical and that it should, but we didn't see how that could be. And I mean, it was interesting, I think, some of the legal opinion that was given here yesterday, because we do see it as a critical issue, and it certainly is for our members and for the women who've been through that experience. In terms of appropriate and inappropriate lobbying, for the National Women's Council, we've been engaged in lobbying since our inception on a whole range of different women's rights issues, and I think we've always engaged in inappropriate lobbying. The question about can we deal with this in any other way, from the National Women's Council perspective, that's why we came into this hearing saying that we absolutely welcomed the decision by government to introduce legislation and regulation, because we believe that was required from the X case and the European Court. So I suppose the answer is no. And then in terms of Senator Mullen's question with regard to suicide, and I mean, I don't come here as a medical expert, but you said, what's your opinion? And I think from our point of view, yes, the numbers would probably be very small, but as was clearly said by, I think, Deputy Conway here on the first day of these hearings, that one life is too many. And again, I would go back and say suicide is a requirement by the X case. But I also think there's a wider issue, and that is the message it sends out to women with mental health problems who are pregnant and in crisis pregnancies, and being able to come forward and seek counselling and support services as well.
Deputy Healy Ames, Senator Healy Ames' comment. No, you're not coming in. Sorry, no. You might just address her question that she asked you.
Sorry, did I not?
The
Question with regard to the claim on your website that the high-profile case in Galway was proof
we're not,
of
sorry,
urgent
we're not mentioning
need.
Galway, sorry, we're not mentioning anything about any case.
Chairman as well, yeah.
Sorry,
The only unborn and their rights, yeah.
If you would,
Flanagan. Sorry, Senator, we're not mentioning anything about any investigation. There's an investigation into particular
no, it's not. It's the claim of it being an urgent proof of urgent need for legislation for X. Why are you putting that when there's no evidence of that?
Well, the reason that was there is that from, I want to be careful what I say, but from yes, absolutely, that from what happened, the huge swell of contacts to the National Women's Council from women who were just so concerned that was a huge issue. And also very clearly, and it was reported so much within the media, the lack of clarity within the medical profession. And that was very clearly put out there in response to that. So that's part of the reason why we would say that.
And Ms. Smith, please.
Sorry, Chairman, I had a question there. Yeah.
Sorry, Deputy Flanagan. Will you resume, please? Thank you very much.
It wasn't answered.
Thank you.
Wasn't answered, yeah.
Thank you, Deputy. You've had plenty of opportunity to come in. Thank you. Ms. Smith, thank you very much.
As a woman with a very long association with the National Women's Council of Ireland, which goes back long before Orla O'Connor's time, and in fact probably since the foundation of the National Women's Council, I want to speak out very strongly in favour of its probity and its integrity, as well as its independence over very, very many years. And I think that it has done and continues to do an excellent job at giving women in this country a platform, a space where our views can be expressed. It's not the case that we always all have the same point of view, but the National Women's Council has always worked extremely hard to make sense of the views that are expressed by the many women in Ireland who see the Council as their representative organ in the state. And that's particularly important for us, given that our representation in this chamber, and particularly in the Dáil, is of course so lamentably low. So my thanks to the National Women's Council for the work that it has done. In relation to the question on safe and legal abortion and what I would mean by that, by safe I mean abortion carried out under medically appropriate circumstances, and by legal I mean quite simply abortion which is permissible by law. I mean nothing more than that. In relation to fatal fetal abnormalities, again, and the question that was raised as regards Simon Mills's bill, yes, I do think, I'm not a legal expert, I don't set out to be so, but based on the arguments in the European Court of Human Rights, the case, I do think that there would appear to be a basis in Article 43.3 for permitting abortion in those cases. But I do believe, along with my colleagues in Choice Ireland, that this is a decision which would always be made by the woman in conjunction with her medical advisors. And finally, and very briefly, the open the gates phrase, which comes up yet again in Senator Mullen's question. Senator Mullen may not be aware, indeed he can't be aware because he wasn't here, but I addressed that issue at some length in my presentation today.
Sorry, we won't have any crisscrossing.
Not a gimlet eye, but no,
thank you.
nonetheless.
Senator Mullen, please, thank you. Thank you.
We have abortion in this country. It just, as I think countless other contributors have pointed out, it just happens elsewhere. It happens off-site. It happens where we can't see it. It happens where we don't have to deal with it. So we do have an abortion rate in this country. I see absolutely no reason to think that that would rise if at all indeed, with the introduction of appropriate comprehensive legislation on abortion in this country. Do we have statistics? Very, very few. We have some witness accounts, but we don't have the statistics, precisely because this is data which is not collected in this country, because technically these abortions don't happen in this country, even though they are abortions which are performed on and requested by women from this country.
Thank you. Deputy Flanagan, you indicated you got very, very briefly now.
Yeah, just my question was about the duty of care towards the
now.
unborn. Do you believe that the unborn has any rights and that there's a duty of care towards the unborn?
Thank you.
From Council's
Thank you.
perspective.
National Council, okay.
I feel I did answer it. What I was saying was that right now, when we're talking about the X case, we're talking about where there is a risk to the life of the mother, and we're saying that that has to take precedence. This is about her life.
In that regard, I want to thank most sincerely Mr. Cynthia Fay and Ms. Abigail Looney from Choice Ireland, Ms. Orla O'Connor and Ms. Jacqueline Healy from the National Women's Council, and from Action X, Ms. Ailva Smith and Ms. Sinead Kennedy for being here this afternoon. And thank you for your presentations and for your time and patience and for your insights, and thank you for taking time to come into us this afternoon. I want to welcome at this stage Minister for Health, Dr. James Riley, to our proceedings. And before we conclude, as we agreed this morning, we will have closing statements from the Minister and from the party spokespeople. So, Minister, you have up to 5 minutes. Come on.
Thank you very much, Chair. And good evening to you and members of the committee and invited guests who are still with us. I am genuinely very pleased to be here today to bring these public hearings on the implementation of the judgment of the European Court of Human Rights in the AB and C versus Ireland case to a close. First of all, I'd like to commend all the members of the committee, those members of the Oireachtas who participated in these hearings, and all the invited guests for the very balanced and dignified approach that we have witnessed over the last 3 days. I wish in particular to thank you, Chairman, Deputy Jerry Buttimer, the members of the committee across the political divide, the clerk of the committee, Paul Kelly, and the committee staff, Mary Lindsay and Colin Duffy, for their work in organising and facilitating this public hearing. Secondly, we have been following the hearings closely and have found the presentations and insights presented by your guests very useful and thought-provoking. I am confident that these submissions and the report that this committee will produce will greatly assist me and my officials in examining the issues involved in the implementation of this judgment and in formulating a legislative response that will stand up to public and parliamentary scrutiny. As you are aware, last December, prior to the Dáil recess, the Government approved the implementation of the judgment of the European Court of Human Rights in the AB and C versus Ireland case by way of legislation and regulation within the parameters of Article 43(3) of the Constitution as interpreted by the Supreme Court in the X case. They also agreed to make appropriate amendments to the criminal law in this area. The aim of this bill will be to regulate access to lawful termination of pregnancy in accordance with the Supreme Court judgment in the X case, and provide for the drafting of regulations to deal with operational and procedural matters relevant to the issue. The advantage of this legislative regime is that the key principles and policies of the primary legislation will be open to the democratic scrutiny of the Oireachtas, while the regulations could be amended if necessary, for example, to address changes in clinical practice and scientific advances. Now that we have had the opportunity to hear the views of medical and legal experts and of those who have had keen interest in this issue, and pending receipt of your report, I will instruct my officials to start developing policy proposals for the legislation. In this regard, much work remains to be done to examine and evaluate the possible avenues for the assessment of an entitlement to lawful termination of pregnancy in Ireland and for delivery of this medical treatment. Excuse me. As the expert group indicated, various options exist in relation to the qualifications of the doctors involved in this process, the number of doctors that will be responsible for reaching a decision, and what their different roles might be, and the locations where terminations might take place. The issue of how to provide for conscientious objection will also need to be carefully considered. In addition, proposals will need to be formulated on how to establish a formal framework to review the initial decision, which is one of the main requirements emanating from the AB and C versus Ireland judgment. And the decision I allude to, of course, is a clinical decision. I wish to reiterate to you that the only purpose of the legislation I will be bringing before the Houses of the Oireachtas is to clarify what is lawfully available by way of treatment in cases where there is a real and substantial threat to the life of a pregnant woman, and to set out clearly defined and specific circumstances in which this treatment can lawfully be provided. It is clear that much work remains to be done by the Department of Health to give effect to the policy requirements to implement the judgment in AB and C versus Ireland through a new legislative framework, and the procedural options are indeed complex given the technical, medical, legal, ethical and health service organisational implications. Can I just finish, Mr. Chairman, again by saying I look forward to receiving your report, and as you heard on Tuesday, once my officials have completed the preparatory work and the heads of bill have been developed, my department will then engage further with this committee. Finally, Mr. Chairman, I want to thank you again and all of those who have participated in any way in these public hearings for the invaluable contribution you have made to this issue and for the assistance you have provided to me and my officials in the complex work that lies ahead of us.
Thank you.
Thank you.
And talk to Billy Keller.
Good Chair, just at the outset I just wanted to put on record my party's appreciation of your efforts in chairing this particular committee over the last 3 days, and it was informative. It was carried out, I think, in a very sort of respectful approach. There is no doubt about it. It is very divergent views. It is very evident from all the, even from the testimony of the witnesses and from the comments of members and of the committee and members of the broader Oireachtas, that there clearly is very strongly held passionate views in this particular issue. We box people into pro-life and pro-choice, but I do believe that there is a large middle ground out there as well that sometimes is voiceless in many of these debates, and I think that we should be very conscious of the many people out there who aren't affiliated to any political party, who aren't affiliated to any organisation, who probably have views that they want to get clarity on this particular issue, to deal with the very complex points that have been made in terms of the strict area that we're working and the confines we're working in of Article 43.3 and its interpretation by the X case. And quite clearly, there will a lot of work must be done still before we see the actual legislation and the content of that, and obviously the regulations that will flow from that. And equally, it will probably be back before the actual committee itself, the heads of the bill, I think, as committed, and then broader discussions in the context of the legislation itself. But I do want to say that, we speak about language, and I do want to say this again, that language is critically important in this debate. It's critically important for a number of reasons, but most importantly because there's up to 130,000 Irish women who have gone abroad at some stage in their life for a termination of pregnancy outside of this jurisdiction. And I believe on whatever side of the argument that one is on, that we should be very mindful that strong language can be very offensive to many, many people. And I just believe there are mothers or sisters, and our neighbours, and we should be just conscious of that. Equally, we should also be entitled to forcefully put forward our point of view as well, without fear or favour, but at the same time being respectful of everybody. So finally, Chair, again, compliments to you, and particularly to the committee staff, the clerk and support staff as well, and the Shannon itself for offering its fine building to us for these particular hearings. And most importantly, that we move on from here very conscious of our obligations as parliamentarians, but equally very conscious of the fact that people outside there are watching us, and they want us to deal with this in a calm, respectful way that addresses the outstanding issues, but only in the context of what is before the committee with regard to it, A, B and C.
Thank you. And talk to Caoimhín Ó Cadhain.
And I wish to use the opportunity to thank not only the groups here present this afternoon, and indeed representatives of some who have given their testimony to us earlier today, but throughout the 3 days, I think all the contributions, irrespective from what position or outlook they came, were hugely informative, helpful, and some, it is fair to say, I think, some were exceptional. I hope that the information gathered over these 3 days of hearings will inform government, inform the Minister and the Department in the preparation of the legislation that they have indicated they intend to present at some point in the early part of this year. I would have to put on record my appreciation of not only the Cathaoirleach of our Oireachtas Committee on Health and Children, but of all the members of the committee. Over a period of some weeks, we had discussed how this particular hearing would take place and our approach. And I have it to say that we agreed that we would endeavour to set the tone for the continued discussion on these very important and very emotive for many issues. And I want to congratulate each and every one of them, across all of the political opinion that they represent, for adhering to that approach. And I hope that that will not be lost on the public, and that it will help in some way in terms of tempering the engagements that will take place undoubtedly over the period of time ahead. I don't know that there is more than I can add at this point in time. I'd like to thank certainly the media for the interest that they have shown, the reportage that they have given to the various contributions. Without that attention to the 3 days of hearings here, a lot of the critical information will be lost in terms of direct public information. And I want to thank those who took the time to attend in the visitors' gallery, those who came, some former members of these houses, members of the public, all interested citizens, as each and every one of us are. And I hope that our work over the period of time ahead will lead to a just situation that will apply in the interest not only of women, but also of children of the future, and that we will look back on this work with some pride.
Thank you, Deputy. Deputy Seamus Healy.
At the outset, Cathaoirleach, I just want to thank you for the manner in which you've chaired these proceedings, and to thank the clerk and his staff for the support to the committee over these 3 days, and indeed over the Christmas and New Year period as well. I want to thank all witnesses who've been before the committee over the last 3 days for both their presentations and their submissions. And I think the submissions, the interactions with the witnesses and the exchanges with the witnesses have been, in my view, informative and have been very helpful. And will inform the committee and indeed the government in the area of legislation in the weeks and months ahead. It is an emotive subject. It's a difficult area, a sensitive area, and it obviously must be dealt with sensitively and compassionately. But I do believe that there is an imperative on the Oireachtas to deal with this issue, and indeed to deal with it urgently. It is not an option to continue as heretofore. As the Minister has said, the proposed legislation will be based on the probability of a real and substantial risk to the life of the mother, and we're talking here about a very limited and a narrow and a rare occurrences, and has been identified as such by in particular the medical witnesses that we've had before us. I would want to say as well that I believe that the area of fetal abnormality could and should be dealt with in the legislation. And I do believe that Dr. Simon Mills, who's identified what he described as a middle ground, and has put forward a sample bill, that bill may be a good template for the future legislation, and it is certainly something that I believe should be looked at very clearly by the Minister and by the Department in the framing of this legislation.
Thank you. And last Cathaoirleach, Deputy Ciara Conway.
Cathaoirleach, and I suppose I first want to start to thank and to put on the record my thanks to the Chairman, to the Clerk and to all the staff for the exemplary way, I think, in which the meetings have been conducted over the last 3 days. And I think what we have shown over the last 3 days, and we're often criticised, and dare I say it, that sometimes politics does work. Sometimes what we're elected to do can happen, and I think that what has happened here in the last 3 days has exemplified that. I have previously spoken about the failure and the shame that I have felt as a legislator for not doing our jobs in relation to this issue. But I, for the first time, am hopeful. I'm more than hopeful. I'm sure that we will be able to legislate and to right the wrong that has existed and the inequality that has existed for women in this country over the last 20 years. And what I would like to say in my closing remarks, after what has been a really informative, very calm and insightful debate, is that we now need timelines in relation to how we proceed and how we implement our decision. Because as we approach March, the 21st anniversary of the X-Case decision, and I'm sure like many more in this room, do not want to have to revisit this at a future date. And I think we owe that to the women and to the children of Ireland. Gurv Malgat.
And talk to Catherine Byrne on behalf of Fine Gael.
Be asked to speak, but anyway.
Thought you read the note.
I didn't actually. I thought it was a secret. No, I thought it was in school again. I suppose, first of all, to thank the Minister for being here, and secondly, to thank you, Jerry, and I hope you don't mind me calling you Jerry. I think that the last couple of days, 3 days, has been a learning curve for me, for somebody who's been in politics not a long time, but in the time I've been here, and particularly in the House here, I think the last 3 days has made it very clear to me what can be done when people work together, and especially people on a committee. And I think as example as to how committees should be run within the confines of this building, I think it's down to the good chairing of his good self and to the participation of all the people who are members of the committee. But particularly to the staff, because sometimes, you know, we never get the opportunity to thank them, and I think this is an occasion to thank them for their prompt response to anything that comes in for to be read, and especially for making sure we're all on time, because we aren't always on time. To the people who have been watching on the television, and quite a number of my family who said I should get my hair dyed, I want to say to most people out there, I think Judge McGuinness said it yesterday. There's the people who are for and the people who are against this legislation, and there's the people in the middle. And they're the people who've been watching. They're the women and young women as well, and mothers who've been watching the debates around this, because this is a very important issue for all mothers and for all young women as well. I think it's a sad reflection on society that's taken so long, again, to be where we are today. But most of all, I think it's an opportunity to build into the future better society for everybody. And, you know, I take the last couple of days as the first steps. I see it as a beginning to change a lot of things within politics, but a beginning to change legislation as well. And I really believe at the end of the day, the decision that the committee will make over the next coming weeks will be an honest, a true representation of what we've heard here and how we felt honestly about it at the end of the day. And I thank the Chair for throwing me into the deep end. Thank you.
Thank you. And finally, on behalf of the non-members of the committee, Senator Jim Walsh has indicated to speak.
And I think I concur with the comments being made. I mean, the feedback from outside as well as that these have been conducted very well and very professionally. But Chairman, as you know, that's only symptomatic of the quality of debate that goes on in this House every sitting day. Even since you left, I'll have to say. Can I thank you personally? You and I had a conversation prior to this, and I'd like to thank you and the members of the committee for the opportunity given to those of us, you know, on both sides of the divide on this, who have deeply held genuine conviction on what is, you know, a fundamental issue of life, that we got the opportunity to participate here in the hearings. And I thank you personally, and I thank the committee members for that. Can I also pay tribute and thank the witness groups who came in, all during the 3 days. I mean, it was obvious that they put considerable work into preparing and indeed presenting their submissions to us. And also the members. It was very obvious that the members had done considerable homework, and I think that stood out in the quality of the questions as well that came. I must say, despite the process being very rushed, and could I say I know that that wasn't your fault, Chairman, and it wasn't the fault of the committee that it was imposed on you, but despite that, I think we've garnered a lot of very useful and good information from the witnesses that came before us. And could I just say in that regard, I was reassured about the quality of the maternal health in Ireland. Everyone who came from the medical profession said, look, current legal position in no way undermines their ability to provide good quality service. Also in relation to psychiatrists, unanimity, even from pro-choice people, that abortion is never a treatment for suicide. And finally, I just want to say, obstetricians are looking for legal protection because they feel exposed. I mean, one of them said they could be put in jail. Now, that's probably unlikely, but still, they're entitled to that. But there's also obstetricians who are concerned that legislation could in some way impact on their ability to provide an effective health service to mothers, and that it could impact negatively. I would appeal to you, and I know you said it this morning that you're going to consider it at your committee, that those people would get the opportunity to be heard, because, as they said, without our views being presented, there's simply no way the hearings can be described as fair and balanced. And finally, I would urge the Minister to listen carefully and to reflect what was said here, not any preconceived notions to where the government wants to go. Reflect what was said here, and nobody will have difficulty.
Thank you. And it would be remiss if I didn't ask the Deputy Leader of the Shannon, Senator Batch, to say a few words as well.
I'm very grateful to you, Chair, and very briefly, as a non-member of the Health Committee, but who has taken an active role in the proceedings over the last 3 days, I just really want to thank you very much, Chair, for your impeccable chairing of the committee, to thank your staff, to thank the members of the committee for allowing us non-members to have input also, and of course also to thank the witnesses over the 3 days who've given us such insight. I'd very much like to welcome the government decision to legislate along with regulations, and very much welcome the Minister's commitment again just this afternoon to provide that legislation. I hope we'll see it in a very short time frame. We have waited, as others have said, 21 years since the X case, 30 years since the 1983 amendment for legal clarity on this. So really, I think it's important that we move to legislate swiftly, but with due consideration for all of the issues that have been raised over the last 3 days. And very much finally, as Deputy Leader of Shannon Dairy, I would just like to welcome all of you who don't pay regular visits to this House, to say that you're all very welcome in this chamber anytime you choose. Thank you very much.
Thank you. And Mark Focus-Scar, as Chairperson of the committee, can I just first of all say thank you to everybody for your participation and for your forbearance this evening. Over the past 3 days, we have discussed the issues which require consideration in the drafting the heads of a bill following the decision of the government to accept the expert group's suggestion that the European Court of Human Rights judgment in the ABC versus Ireland be addressed by putting in place legislation or regulation within the framework of our current constitutional provisions stated in Article 43(3) of the Constitution as interpreted by the Supreme Court. Over the course of our hearings, we have heard from medical and legal experts who have outlined a range of issues for further consideration. Today we heard from representatives of religious and atheist group, as well as from a range of advocacy groups who have outlined their positions. Our meetings have enabled us to elicit much information on current medical practice, allowing us all to become fully informed and aware of how current medical guidelines and practices are implemented. For over 30 years, as has been stated, this issue has been a very vexed question in Irish society, but across our communities there are sincerely held views across a wide range of views, and at times during previous discourse debates they have become very heated. Over the past 3 days, our hearings in this committee, in this chamber, have been conducted in a very calm, tolerant, respectful way, showing that even on this deeply sensitive issue, it is possible to engage in a manner which is measured and which facilitates a nuanced discussion. Our constructive and positive engagement has only been possible because of the approach taken by our witnesses and also by members of the Oireachtas Éireann, who have contributed significantly to our hearings. I would like to thank you all most sincerely for, first of all, appearing at our committee and for attending, for your time, for your very helpful contributions and for your thorough preparations. To my Oireachtas colleagues, I want to say to the members of the committee and to the non-members, I very much appreciate the way in which you have all discussed the issue and raised your own concerns. This has contributed to demonstrating that our political system can engage in a mature way on the most difficult of issues. I want to put on record my appreciation to the Cathaoirleach of the Seanad CPP and the Clerk of the Seanad for allowing us to hold our hearings in this very fitting chamber, this one of Shannon Éireann. I am very conscious that it was not possible for our committee over 3 days to invite in each of the very many groups and individuals who would have liked to have made an oral presentation and submission to us. Members of the committee and other members of the Oireachtas made suggestions as to who should be invited to our hearings, and all suggestions were considered by the committee before members agreed upon whom to invite. In deciding whom to invite, the committee attempted to ensure that there was a very fair and balanced expression of views, as well as guaranteeing that we heard from experts, both academic and practising, from the legal and medical fields, but also from religious and advocacy groups. I want to say a particular thank you to the members of the Health and Children Committee for your help, assistance in the running of these hearings. As a committee, we have worked well together, putting aside partisan politics and also parking our differences of opinion on this particular issue. I want to in particular pay tribute to Deputies Kelleher and O'Quailon as the representatives of Fianna Fáil and Sinn Féin, and to Deputy Healy and Senator Van Turner on behalf of the Independents for their tremendous cooperation and assistance and work in the committee, and also to members of the Fine Gael and Labour parties as well. I very much appreciate your contributions in acknowledging the decision of government. Your assistance in the organisation of our hearings and the way in which we have engaged has greatly assisted our efforts, and I hope your parties will be very proud of your contribution over the past 3 days and indeed over the past month in organising these hearings. I want to say the organisation of our hearings has only been possible because of the immense effort of the committee secretariat. To our clerk, to Mary Lindsay and Colin Duffy, thank you so much for your enormous contribution of work. You have undertaken this work during your Christmas holidays. You've been awoken at 12 o'clock at night and at 5:30 in the morning, and you have answered promptly, courteously and efficiently, and you were dedicated and an example of how public service works in this country. Now that our hearings are complete, I want to also pay tribute to the staff from the wider committee secretariat who have supported our clerk and Colin and Mary for the duration of our hearings. I want to put on record my appreciation to the Superintendent of the House, the Captain of the Guard, and to a very cooperative team of ushers who have made this transition to this chamber very easy and who have been very helpful to us throughout. And to the staff and the editors of the Debates Office, the Broadcasting Communications Unit, our sound engineer Ken today and Alan and all the others, and finally the staff of the Library and Research Service, and also the Parliamentary Legal Service, who will continue to be of assistance to the committee as we prepare a report. Finally, I would like to thank all of our witnesses who have been with us for the past 3 days. You have made this decision to hold these hearings very worthwhile. Now that we have concluded our hearings, our committee will reconvene next week, and at our meeting we will commence the process of preparing a report for government. Our report will be a summation of the information we have gathered from all of the witnesses who have given evidence, and we will also include in our report written submissions which we have received. When completed, we will submit a report to government for its information and use when drafting the heads of the bill. I want to thank Minister Riley for coming in to us this afternoon and for his restating the important role which these hearings have been in the legislative process. And we as a committee very much welcome that he has confirmed that the committee will be used again as a source of information in drafting the heads of the bill, and hopefully as part of the heads of the bill at the committee stage. Again, can I sincerely thank everybody for their participation in our series of constructive hearings over the last 3 days, and our committee stands adjourned until 9:30 next Thursday morning, January 17th. Good morning.